We start again.
So common carotid, and then it's broken up into your external and internal branches.
Yep. Talk a little louder.
Okay, and then, go ahead.
All right, so she said common carotid, point out that.
Common carotid.
And then you can see the...
External with all the branches, and then internal is here.
Okay. And then what do you see right there at that level? You see the swelling here, and that would be the carotid what? Carotid sinus, and the carotid body is going to be located there. Remember, that's where those baroreceptors are, right? Okay, good.
Off of here, the first branch here is the superior thyroid. And if you can see, it splits. And I guess we're not really sure. One of these is the superior laryngeal, and then the other one continues on as the superior thyroid.
And follow it all the way down, because you can see where it goes all the way to the...
This one, yeah, it goes right into the thyroid gland right there.
Okay, good.
And then up here, you have your hypoglossal nerve. This first branch here is lingual artery. This is facial artery right here. And then you can see it comes up right through here. It's facial. And
then the continuation would be the rest of the external carotid.
Yep. This is your vagus nerve. It was cut, but that's the vagus nerve that comes down. And then here along your anterior scalene is your phrenic nerve. Right here, these are your scalenes, your anterior, your middle, and then your posterior back here.
And the brachial plexus should come between the anterior and middle. Okay? And then that phrenic nerve should be always lying directly superficial to the anterior scalene. Okay? And so the way to differentiate between phrenic and vagus is phrenic is always going to be right here, just anterior to the anterior scalene, and vagus should be in the carotid sheath with the common carotid and the internal jugular. Okay? Good. I'm showing subclavian.
Okay, so down here you can see here's your subclavian, and then coming off your subclavian is your thyrocervical trunk right here, which it's not showing anymore, but then this would also have an inferior thyroid artery as well. And then coming off down here is your internal thoracic.
All right, and remember, internal thoracic, we followed all the way down. That's the one that goes on the internal surface of the sternum, gives off all of your anterior intercostal arteries, but that's where its origin is. Thyrocervical trunk, we've talked about some branches off of it. All right, what are some of those branches? Other than the inferior thyroid, superficial cervical or transverse cervical, depending on which situation we have. Okay, and the suprascapular. So this branch, since we can't really see where it's going, it's hard to tell which one that is, but it's either superficial cervical or suprascapular. So, okay? Great.
I think, yeah. And there's a little bit of facial nerve right here. You can see that.
Okay.
I think that's everything for this.
Okay. And then obviously you've got submandibular gland up here. So, all right, let's stop it.